Hello, I'm Dr. Sanjeev Katua, President and CEO of Unity Point Clinic. Here at Unity Point Health, we currently employ nearly 80 physicians on temporary visas who are waiting to receive their green cards. These are people who, as physicians, serve crucial roles in our clinics and hospitals and are active, contributing members in our communities. They're also people who took a chance on us and uprooted their lives to be here, to care for our families, friends, and our neighbors. Since coming to Unity Point Clinic to serve our patients, these physicians have had a tremendous impact. In 2019, more than 95,000 Unity Point Clinic visits occurred with physicians on temporary visas. That's about 1 out of every 10 clinic visits that year. They practice in family medicine, internal medicine, pediatrics, and in 12 medical specialties, such as pulmonology, infectious disease, and hospice care. In 2019, these physicians provided care for 39% of clinic pulmonology visits and 36% of infectious disease visits. Specialty physicians are desperately needed in our local communities, and they're some of the most challenging roles to staff. That was especially true during the first wave of COVID-19, as it is now with the rise of Delta variant cases. The stability for our doctors is also a critical tool for recruitment and retention across our system. More importantly, stability provides the peace of mind our physicians work day in and day out to give to others. And I believe we owe that to them. Watch as one of our physicians, currently on a temporary visa, shares his story with you, one I believe you'll be inspired and humbled by.
Before I joined Unity Point, it took about 10 years of recruitment research to find a physician who can fill this position. And I have been a part of Unity Point in Central Illinois since 2015. The hospital has filed for permanent residency for me. So I have been waiting for permanent residency since 2015. So it's almost like, 11 years now, and I'm still in that phase where I have to renew my visa every 3 years. Immigrant physicians, they are an essential part of the fabric of American healthcare and society. They are also serving in communities which are, rural, underserved. They are serving minority populations. It is estimated that by the year 2025, there would be a shortage of 46,000 to 90,000 doctors. So, that highlights the importance of the role immigrant physicians would be playing in the future as well. Having an expedited permanent residency will clear a lot of fear and concerns that most doctors have when they are working in this, highly complex fields. And going through COVID-19 pandemic, it has really brought to our attention that I think the concerns are real. What if something happens to me? What would happen to my family? My child, she is an American citizen by birth. So what would happen to her? At this point of time, the estimated time period for me to achieve the permanent residency is anywhere between 15 to 20 years. It is extremely important to get this process expedited for permanent residency because it will help improve overall healthcare. It will fill in the gap in the American healthcare, and it will put fears and concerns of immigrant physicians to rest because they would be better able to focus on their job.
Thank you for watching and taking the time to hear just one of the many stories of these incredible physicians. We look forward to partnering with you in support of our amazing workforce and encourage, support, and passage of the Healthcare Workforce Resilience Act.